Welcome back, YouTube. I'm Dr. 𝐤𝐤𝐤. Today's topic is, what is the endocannabinoid system? I'm actually going to label this series Medical Secrets, okay? And why am I calling it that? Because endocannabinoid system was a medical secret kept from me and a whole bunch of medical doctors that went through medical school thinking they learned about all of the body's systems. Okay, so I'm going to explain that this way. So how I discovered the endocannabinoid system was through a patient. And this was a patient that I was treating for chronic pain. And he came into my practice one day telling me that he didn't need the refill for his opioid. And I said, oh, okay, you still have some left? He said no, he was completely out, but he has chosen not to take opioids anymore. He was going to start using, or has started using, something called CBD. And I looked at him and said, CBD to replace opioid? And he said yes. In fact, it's been working for him so much better that he decided not to refill the opioid. And that really caught me by surprise. I mean, I looked at his wife and went, is this serious? Because up until that point, the only thing I knew about CBD and the whole cannabis plant was what I learned in medical school, which was all of the dangers of smoking marijuana. Okay, that's all I knew. It was just, don't do it. That's all we were taught, or I was taught, at least in my program. And I didn't realize that there was so much more to this plant, and so much more that a whole system in the human body was removed from the textbook, the medical textbooks, and never taught to a medical doctor. And I was released into the world to go save patients. And I didn't know there was a system that we are born with called the endocannabinoid system. So this was quite a surprise for me, because after this patient left, I was so perplexed. So I went in to the textbook to find out, does CBD really help pain that good? Because this is why this really took me by surprise. Because this particular patient, every time he came into the clinic, was asking for an increase in his medication dose. So for him to go from always asking me for an increase and me saying, no, we're not going to increase it, to saying he didn't need the medication anymore was such a shock. I really thought maybe he was getting it from somewhere else. I really didn't believe it. Okay, so of course his wife confirmed he's not getting it from anywhere. He started buying this product that supposedly was a hemp extract that contained a high amount of CBD and very, very low amount of THC. And he had been taking that orally as a tincture that he put under his tongue every few hours, and that was treating his pain so much better. So this led me to go do my research. Then it's got to be something that I'm missing. How is this substance, this over-the-counter supplement at the time, could be this helpful? And I didn't know anything about it, right? So I went and started digging into it. Of course, as I was digging into what is CBD, I started seeing THC. I learned about the whole cannabis plant, hemp plant versus the marijuana plant. And I also came across the endocannabinoid system, which is what we're talking about today. So what is the endocannabinoid system? So what I found out was that this system we're actually born with, and it is a system in our body just like the circulatory system, the pulmonary system, the skeletal system, the muscular system, the endocrine system, the enteric nervous system, the central nervous system, and the peripheral nervous system. and so on. We know about all these systems, and we were taught about all these systems in medical school. But endocannabinoid system was never taught. And I was surprised and in shock that there is actually a system in the body that I didn't know about. So, of course, I delved in, tried to get more research, went into the National Institute of the Library of Science, went into like textbooks and went into, medical journals to try to learn more about the system that I just didn't even know existed. So I learned that the endocannabinoid system has actually been in our body from the get-go, okay? We're born with it. The system, its job is homeostasis. And what that really means is its job is to bring balance back to the body. And as long as there is an imbalance in the body, this system is there, has receptors everywhere in the body to bring things back to balance. It's important in the communication between cells, it's important in the central nervous system, it's important in the reproductive system, it's found in the gut, it's found in the immune system, I mean literally everywhere. So once I found out what this endocannabinoid system was, I now think of it like a switchboard, right? Like where its job is to direct and correct any type of imbalance in the body. So whether the imbalance is from pain, whether the imbalance is from trauma, from stress, from inflammation, from mental disorder, from toxins, from just name it, its job is to bring balance. So the endocannabinoid system has receptors. We call this CB1 receptor and CB2 receptors. CB1 receptor is mostly found in the central nervous system, while CB2 receptors is found in the periphery, where like things like the gut, like the immune system, like the reproductive system, and so on. And its job there, like I said, is just to bring homeostasis to those body systems. Now, besides the receptor, you also have what we call the endocannabinoids themselves. These are the actual, think of them like when you have a receptor, you have a ligand, we call it. A ligand is like a structure that binds to that receptor. Think of it like if the lock is the receptor, the key is the ligand. Okay, so the ligand in the endocannabinoid system, we've got a couple of them that have been discovered so far. There might be more, okay? The couple that we know of is anandamide, and then the other one we call AG2, or 2AG, okay? So 2AG is basically arachidonyl glycerol, okay? AG2, or 2AG is what we call that one. Anyway, the point is, with these two bind to the receptors, and then from the receptor, there is actions that happen downstream, okay? So on the cell is the receptor, these ligands, aridamide, right, binds, and then causes reaction within the cell to cause whatever effect that was needed to bring balance back to that cell, okay? So that is kind of what we need to just briefly understand about the endocannabinoid system. Now, why are we talking about it? Okay, well, the endocannabinoid system we find, even though it exists in our own body, makes its own cannabinoids, is similar to it's the same receptors that the cannabis plant or the hemp plant binds to when it gets in our bodies. And this particular patient that I'm telling you guys about found out that by taking this oil extract from the cannabis plant, it modulated his body so well that it reduced his chronic pain to the point where he didn't need to take the opioid anymore. And that opened my eyes to learn more about the system. And as many of you now know, this was the beginning of me including this plant as part of the medicine in my toolbox. I'm going to go into the second part of this and just talk about the cannabis plant a little bit more so that you can understand how you can start to use it to help you with a lot of imbalances that might be going on in your body system. Hope this has been helpful. Did you know there was an endocannabinoid system? Comment in the section below if you knew that. All right, I'll talk to you and see you on the next one. Bye.